Then there's Medicare. Because healthcare costs keep rising and the baby boom generation is retiring. Medicare, we all know, is one of the biggest drivers of our long-term deficit. That's a challenge we have to meet by bringing down the cost of health. Care overall so that seniors and taxpayers can share in the savings. But here's the solution proposed by the Republicans in Washington, and embraced by most of their candidates for president. Instead of being enrolled in Medicare when they turn 65, seniors who retire a decade from now would get a voucher that equals the cost of the second cheapest health care plan in their area. If Medicare is more expensive than that private plan, they'll have to pay more if they want to enroll in traditional Medicare. If healthcare costs rise faster than the amount of the voucher, as, by the way, they've been doing for decades, that's too bad. Seniors bear the risk. If the voucher isn't enough, to buy a private plan with the specific doctors and care that you need, that's too bad. So most experts will tell you the way this voucher plan encourages savings is not through better care at cheaper cost. The way these private insurance companies save money is by designing and marketing plans to attract the youngest and healthiest seniors, cherry picking. Leaving the older and sicker seniors in traditional Medicare. Where they have access to a wide range of doctors and guaranteed care. But that, of course, makes the traditional Medicare program even more expensive, and raise premiums even further. The net result is that our country will end up spending more on healthcare. And the only reason the government will save any money it won't be on our books is because we've shifted it to seniors. They'll bear more of the costs themselves. It's a bad idea, and it will ultimately end Medicare as we know it. Now, the proponents of this budget will tell us we have to make all these draconian cuts because our deficit is so large. This is an existential crisis, we have to think about future generations, so on and so on. And that argument might have a shred of credibility were it not for their proposal to also spend $4.6 trillion over the next decade on lower tax rates. We're told that these tax cuts will supposedly be paid for by closing loopholes and eliminating wasteful deductions. But the Republicans in Congress refuse to list a single tax loophole they are willing to close. Not one. And by the way, there is no way to get even close to $4.6 trillion in savings. Without dramatically reducing all kinds of tax breaks that go to middle-class families, tax breaks for healthcare. Tax breaks for retirement, tax breaks for homeownership. Meanwhile, these proposed tax breaks would come on top of more than a trillion in tax giveaways for people making more than $250,000 a year. That's an average of at least $150,000 for every millionaire in this country. $150,000. Let's just step back for a second and look at what $150,000 pays for. A year's worth of prescription drug coverage for a senior citizen. Plus a new school computer lab plus a year of medical care for a returning veteran. Plus a medical research grant for a chronic disease. Plus a year's salary for a firefighter or police officer. Plus a tax credit to make a year of college more affordable. Plus a year's worth of financial aid. $150,000 could pay for all of these things combined investments. In education and research that are essential to economic growth that benefits all of us. For $150,000, that would be going to each millionaire and billionaire in this country. This budget says we'd be better off as a country if that's how we spend it. This is supposed to be about paying down our deficit. It's laughable. The bipartisan Simpson-Bowles Commission that I created, which the Republicans originally were for until I was for it, that was about paying down the deficit. And I didn't agree with all the details. I proposed about $600 billion more in revenue and $600 billion it proposed about $600 billion more in revenue and about $600 billion more in defense cuts than I proposed in my own budget. But Bowles-Simpson was a serious, honest, balanced effort between Democrats and Republicans to bring down the deficit. That's why, although it differs in some ways, my budget takes a similarly balanced approach. Cuts in discretionary spending, cuts in mandatory spending, increased revenue. This congressional Republican budget is something different altogether. It is a Trojan horse, disguised as deficit reduction plans. It is really an attempt to impose a radical vision on our country. It is thinly veiled social Darwinism. It is antithetical to our entire history as a land of opportunity and upward. Mobility for everybody who's willing to work for it, a place where prosperity doesn't trickle down from the top. But grows outward from the heart of the middle class. And by gutting the very things we need to grow an economy that's built to last: education and training. Research and development, our infrastructure. It is a prescription for decline. And everybody here should understand that, because there's very few people here who haven't benefited. At some point from those investments that were made in the 50s and the 60s and the 70s and the 80s. That's part of how we got ahead. And now, we're going to be pulling up those ladders up for the next generation. So in the months ahead, I will be fighting as hard as I know how for. This truer vision of what the United States of America is all about. Absolutely, we have to get serious about the deficit. And that will require tough choices and sacrifice. And I've already shown myself willing to make these tough choices when I signed into law the biggest spending cut of any president in recent memory. In fact, if you adjust for the economy, the Congressional Budget Office says the overall spending next year will be lower than any year under Ronald Reagan. and I'm willing to make more of those difficult spending decisions in the months ahead. But I've said it before and I'll say it again there. Has to be some balance. All of us have to do our fair share. I've also put forward a detailed plan that would reform and strengthen Medicare and Medicaid. By the beginning of the next decade, it achieves the same amount of annual health. Savings as the plan proposed by Simpson-Bowles, the Simpson-Bowles Commission. And it does so by making changes that people in my party haven't always been comfortable with. But instead of saving money by shifting costs to seniors, like the congressional Republican plan proposes, our approach would lower the cost of health care throughout the entire system. It goes after excessive subsidies to prescription drug companies. It gets more efficiency out of Medicaid without gutting the program. It asks the very wealthiest seniors to pay a little bit more. It changes the way we pay for health care, not by procedure or the number of days spent in a hospital. But with new incentives for doctors and hospitals to improve their results. And it slows the growth of Medicare costs by strengthening an independent commission, a commission. Not made up of bureaucrats from government or insurance companies. But doctors and nurses and medical experts and consumers, who will look at all the evidence and recommend the best way to reduce unnecessary health care spending while protecting access to the care that the seniors need. We also have a much different approach when it comes to taxes, an approach that says if we're serious about paying down our debt, We can't afford to spend trillions more on tax cuts for folks like me. For wealthy Americans who don't need them and weren't even asking for them, and that the country cannot afford. At a time when the share of national income flowing to the top 1% of people in this country has climbed to levels last seen in the 1920s. Those same folks are paying taxes at one of the lowest rates in 50 years. As both I and Warren Buffett have pointed out many times now. He's paying a lower tax rate than his secretary. That is not fair. It is not right. And the choice is really very simple. If you want to keep these tax rates and deductions in place or give even more tax breaks to the wealthy, as the Republicans in Congress propose, then one of two things happen: either it means higher deficits, or it means more sacrifice from the middle class. Seniors will have to pay more for Medicare. College students will lose some of their financial aid. Working families who are scraping by will have to do more because the richest Americans are doing less. I repeat what I've said before: that is not class warfare, that is not class envy, that is math. If that's the choice that members of Congress want to make, then we're going to make sure every American knows about it. In a few weeks, there will be a vote on what we've called the Buffett rule. Simple concept: if you make more than $1 million a year, not that you have $1 million, if you make more than $1 million annually. then you should pay at least the same percentage of your income in taxes as middle-class families do.